Okay, welcome to Pelvic Floor Month. I'm chatting with Victoria Smith. Victoria, did you want to just tell us a little bit about what you do?
Yes, so I'm Victoria Smith. I'm a hip specialist physio. So I work a lot with predominantly women, to be fair. Women seem to get more hip pain in my area. But so yeah, lots of women. I work in the NHS and I work privately as well. So that's my area of expertise. I do knees as well, but hips are definitely my favourite and huge passion for them. So it's nice to be here sharing the wealth of knowledge I've learned over the last 23 years, which is pretty amazing. Yeah.
Awesome. So just before we started recording, I was kind of saying, so you specialize in hips. How's that going to tie in with pelvic floor, which obviously is this month's topic? So tell me.
So I work really closely with the women's health physios actually at work because we share so many patients. And I think it's not often recognised that hip pain and pelvic floor are linked, as you just said. So a couple of the hip muscles, the deep muscles, are actually part of the pelvic floor wall. So they're doing their sort of dual roles, one to provide that pelvic floor, that part of the bowl, if you like, at the back, but they're also deep stabilizers for the hip joint. So the other link is the adductor muscles, which is on the inside of your thigh. They have a lot of fascia, which again attaches to the muscles that sit around your anus, so the muscles that control the sphincter there. So there's quite a huge involvement of the hip with pelvic floor issues, and the two can bounce off each other. So if you have an overactive pelvic floor, then that can have a huge impact on how the hip muscles work. So it's linked really closely. Similarly, if you've got a pelvic floor that isn't strong enough, isn't doing its job properly, then you can over recruit some of these muscles around the hip to try to help out, and then you get a painful hip because the muscles around the hip start to what we call grip. So they become really sort of almost working too hard. They're doing too much. So they rarely relax. So you've got a hip that's got muscles around it that's working too hard. You then ask that hip to go for a walk, and those muscles can't work hard enough because they're already working too hard just actually sitting or standing. So yeah,
I find the human body fascinating in this respect, that things that different muscle groups will compensate for ones that aren't working. So we as lay people don't necessarily think there's a problem, or we might think that the problem is in a different part of our body to where it actually is. And that's where people like you are, worth your weight in gold, frankly, because you can unpick all of that and get down to where the original problem is, and then help to unravel that.
I think that's it. It is that unpicking, and often a lot of the ladies I see will have suffered with their hip pain for a long time, and they've been given exercises to do. They've seen various physios or whoever, and they've been given things to do, but because their muscles are just working so hard all the time, the exercises don't work because you haven't unpicked, as you said, that part of the puzzle. So with this issue, what you have to do is actually get those muscles to learn how to not be working all the time, how to switch off a little bit, so then you can teach them how to go back on, but when they should be working. So not being on all the time. I mean, it's quite a crude way of talking about it, but it kind of means you can understand it. So muscles aren't off and on generally, they're sort of low level or high activity, but yeah, so it's it's such a common finding. I see this in so many of the ladies I work with, and they're like, I didn't know I was doing that. I'm like, you wouldn't, because this is normal for you. This is your norm, where your muscles are just not used to, not being there, not sort of down regulating a little bit. It can happen as well in somebody, say, we all kind of hit 40 and we go, I need to get fit. So a lot of people start doing couch to 5K, enjoy it. But again, if you haven't got the sort of the strength around either the pelvic floor or the deep hip muscles, then you're going to get this. You could get this potential upregulation of one or the two, which can cause issues. I saw a lady last week, and she was just pretty much her whole pelvis and legs were just gripped on. So you couldn't actually move her hip independently of her trunk. So if you move her hip, everything moved.
Wow.
together, and that happens so much. So she then developed stress incontinence as well, because everything was working so hard that when she then needed to use those muscles, they weren't working hard enough, so she would leak.
Yeah,
So,
which
yeah,
all makes sense when you
it
put
does,
it like that,
doesn't it?
because I think there's a kind of perception out there generally, you know, in the world at large, that we just, you know, do a few Kegel exercises and ta-da. But like with anything, if that muscle is already misfiring, for want of a better term, I don't know if that's a correct term, then, you know, with all the will in the world, and taking it back to the running idea, you know, if you run and you've got a sort of lopsided gait when you're running, until you fix that, the wrong muscles are firing, aren't they? And it only stands to reason that the same happens across the whole body.
Pelvis, yeah, absolutely. An overactivity of the pelvic floor is, I was speaking to the women's health physios that I work with, it's actually, they kind of feel it's more of an issue than just being weak. So you can have an overactive pelvic floor. It doesn't mean it's strong, it just means it's working too hard all the time. Often what you need to do is, down train it and then teach the muscles how to, you know, work in their normal role. So yeah, it's an interesting area to work with. It's quite hard, because you have to teach that person, one, what it feels like to not be, or we call it gripping, because you're almost gripping with the muscles, and we have to teach them how to actually learn how that, I don't like to say the word relax, because they often don't know what relax means. I say take the tension out of the muscles, and there's loads of strategies that we can use to you know, help that along the way. But it's finding the right strategy for that person. It's often, sometimes it can go back years, sometimes it can be a trigger, a reason why people have sort of developed this sort of strategy for gripping. It can be an injury, it can be a pain in the hip, that the brain's just gone, okay, you need to protect that hip, let's work too hard. It can be, you know, various different reasons why you develop an overactive or grippy sort of pelvic floor. Loads of reasons. Some of them you know, might stem back to trauma, either psychological or physical, but yeah, they then develop a response to grip. It can just be weak muscles, it can just be, you know, lifestyle, not keeping active, but yeah, there's so many different things that we need to work out. And again, as you said, unpick, that's the key word. Unpick, why is this happening? What can we do to try and calm it down, so that we can then, you know, get you working in a much healthier way. And this can happen at all ages, but it's really common in perimenopausal, menopausal women. Huge issue. And yeah, it's not often spotted because people don't know about it.
No, and I guess what I'm about to ask is very much a how long's a piece of string, I suspect. I'm going to ask it anyway.
Yeah, no, go for it.
Are there any exercises that people can kind of safely kind of assume they could be doing, or is it very much that each individual needs to unpick for them?
Yeah, no, there's definitely some things that you could start off with. So if you're kind of person who's got kind of pelvic pain, lots of pain around the hip, maybe in the thigh, just generally achy, maybe some buttock pain as well, I mean, it can affect the whole body. One of the best things to start to do is breathing. So breathing exercises are really good. So we want to tap into the vagus nerve. So the vagus nerve, obviously one of the cranial nerves, parasympathetic system. So it's working to deregulate those fight and flight responses. So there's a theory called the polyvagal theory, which is fascinating. And the way we kind of work with these kind of grippy type patterning is actually one way is with the polyvagal theory. So that's looking at breathing. So you want to tone the vagus nerve. The vagus nerve is not allowing those muscles to relax. So it's kind of working to keep you in this kind of freeze mode almost. Have a look at polyvagal theory. It's fantastic. It's fascinating. It'll explain more. But doing good breathing. So in a relaxed position, so somewhere you feel comfortable. Has to be somewhere where you feel safe. It's all about feeling safe. Unless you're feeling safe, your muscles will still be in this heightened state. So I sort of say, where do you feel like you're most relaxed? Where's your happy space? You know, where do you like to be? It could be at home in a bedroom, for example. That's the easy thing is to say, let's pretend you're in your room. You've got your lights dim, maybe some candles on if you like that, listening to a podcast or some music or nothing, whatever sort of floats your boat. Then big pillows, put them underneath your knees so that you've got somewhere to relax. Support is the key with this thing. So pillows underneath your knees, and I like to put pillows under arms and under your head so that your whole body is just feeling supported. So there's no need for your muscles to have to be working anymore, because they're feeling that support and they're going, okay, I can take the tension down. So that's a really good starting place, and that's something I encourage ladies who have it to relax in. So or you could say, well, lie on your side with pillow under your knees, pillow under your arms if you feel side lying is more comfortable for you, or your tummy. It's just got to be somewhere you feel comfortable and supported. So obviously breathing's easier on your back or your side than tummy. But so once you're in this position that you feel you can actually feel calm in and safe, taking a big breath in through your nose and really you want to check how your breathing pattern is. When you breathe, you put your hand on your rib cage and your tummy. If when you breathe everything comes up, then we want to just change that, because we want to get the diaphragm involved, because the diaphragm and the pelvic floor are really, really linked. So you want to put your hands on your rib cage, and as you breathe in, you want your ribs to come out and up and your tummy to go out as well. You want to take a nice long breath in and then hold it for about 4 or 5 seconds. And while you're holding, you could try and think, okay, take the tension out of your jaw, tension out of your pelvic floor, tension out of your legs, out of your arms, and then let that breath go. And your breath out should be longer than your breath in, roughly, but it doesn't matter if it's not. And then working through that cycle about 10 times can be a really nice, really good way to start to unpick the element of gripping. And the pelvic floor and the jaw are really linked in. So if you clench your jaw, then you're likely to be drawing that tension up through those muscles as well. So relaxing the jaw, relaxing the face, taking the tension out of here can have a really positive impact on this as well. And I have a few patients that just working on relaxing the jaw, and they're like, but it's my hip that's the problem. But relaxing your jaw can really help. So sometimes when you're starting to move through different exercises, you have to say, remember your face, relax, you keep the tension out of your face, tension out of your jaw, because they automatically go. So it's linking that in as well. So the key things I would say that anyone could add in is looking at the facial tension, jaw, and then relaxing with support and adding breathing in. That's the foundation as to what we start with. So that's a nice, easy way people can, add it into their life. And often people are really shocked that they're doing it. They're like, I didn't know I was doing this. How have I done this for so long and not realised? And it's so common, but it can make a huge difference to management of pain once people are aware of it. It can really, really change things, because then you can move into slightly more advanced rehab and then progress that on, because it affects everything. It affects life in terms of just walking to the shop or getting in the car and driving. The other things people can often do it in the car, so they're driving and they start tensing, and they don't know they're doing it, and everything's becoming tense, and they're gripping around the hip, gripping around the pelvic floor. Sometimes sitting on something, so a folded towel or a little ball. Obviously the firmer the ball, the more difficult it will be, and just sitting on that, putting it underneath your perineum and seeing if you can just let go into that ball. That can be really, really helpful as well. So put it in the car or when you sat at your desk, just trying to let go. And you can often find tension, you kind of spike the tension, and then you go, no, I've got feedback. Having that feedback's quite good, so you can relax over it. And that's the thing.
That's the thing. When muscles are really tight, we're not getting feedback, are we? We're getting feedback as pain maybe somewhere else.
Yes,
but not immediate.
Normal Yeah, it's normal. It doesn't realize that that muscle is working too hard. It's just, that's how I am. So it's actually, first thing is to recognize that. And often people don't realize they're doing it. So if you're lying on your back with your knees bent, you should be able to, if say me as a physio, I should be able to hold that leg and just move it out, and the leg should move on its own independently of the pelvis. If someone holds that leg and moves it and everything moves, then it's a sign that actually those muscles are working too hard and they're not letting go. So we call it hip and pelvic dissociation. So you can't dissociate between the pelvis and the hip. Everything's moving together all the time. So it's a big issue, and yeah, that can cause pain. Doesn't always, you know, as I say with everything, it doesn't always cause pain, but it can often be a big root cause of things. So yeah.
That's awesome. Thank you so much, Victoria. I feel like you've given people some really useful, actionable things, but I know we could keep talking forever on this.
No, I think
so I'm gonna say thank you now.
Otherwise it can start to get a little bit like, well, I don't know, how do I do that? And I think
exactly. I think I always want to keep it really nice and simple for people.
Absolutely, great.
That's awesome. Thank you so much.
You're very welcome.